main reason I chose this topic was I took up this challenge because I figured out that this data protection laws and this discussions has not been done in our openIMIS forums, which is a very integral part. So today I will be outlining following. I will be talking a bit about HIPAA and GDPR and technological implications and data protection laws in Sri Lanka. If you take Health Insurance Portability and Accountability Act, it was established in 1996. It has 5 main titles. Title 1 refers to safeguards workplace healthcare benefits as well as their families who shift or lose their employment. It restricts the right of new healthcare plans to reject health insurance because of previous illness. Title 2 prevents exploitation and misuse in the field of healthcare, medical liability and unification, administrative generalization that calls for national requirement for electronic medical transactions and national recognition for providers, employers, and health insurance policies. Title 3 refers to protocols for pre-tax accounting and of healthcare spending. It offers amendments to the legislation on healthcare and medical insurance deductibles. Title 4 refers to the group health schemes guidelines. It provides health coverage adjustments. Title 5 includes clauses concerning the corporation-based life insurance and the treatment of persons without U.S. citizenship. So, I mean, this U.S. laws, and it's important. For country specific adaptation, it's important for us, our implementers, to study the HIPAA, especially Health Insurance Portability and Accountability Act, and the GDPR before coming up to our country specific national laws. So when it comes to HIPAA, they have like very defined categories like broad target groups. They call a covered entity, business associates, subcontractors. So if I think these are very important because let's say personnel collective policies which render or pay the medical treatment costs are covered are referred to as covered entities. A business associate is usually an individual or an institution other than the covered entity that carries out certain tasks or activities on account of a covered entity or offers certain support to the covered entity comprising the use or divulgation of personally identifiable healthcare data. Features of business associates on account of a covered entity include such as insurance claim reviews, statistical analysis, usage evaluation, accounting, and business associate activities are confined to legislation, actuarials, finance, consultancy, data aggregation, management, certification, or financial services of the covered entity. And subcontractor is defined as the instances such as if a covered entity employs a contractor or other service provider to provide business associate operations. The rule mandates that the covered entity provides such information security mechanism in the business associate agreement, or similar to subcontractor agreement as well. So, and another interesting terminology is healthcare clearinghouse. They are like organizations processing non or semi-standard data from another organization towards standardization or vice versa. And one of the key term I'm going to use is protected health information. From here on, I would use it as PHI. It comprises of all details which can be used to recognize an individual. Any element of an individual's health record or record of payments is regarded as personal health information, PHI, and therefore cannot be exchanged among unauthorized people. PHI is utilized in a healthcare facility and involves written and verbal instructions. They can be either electronic records, paper-based, medical documents, healthcare insurance policy records, providing information and legislative departments. And there are 5 rules when it comes to HIPAA. They are termed as privacy rule, security rule, enforcement rule, omnibus rule, and breach notification rule. The privacy rule applies to information or processes, services users' rights to access and change information in their health records and administrative specifications. It refers to all the information identifiable uniquely, including the information found in the electronic, paper, oral communication, commonly termed as PHI. And the security rule requires that a covered entity implements operational protections, physical and technical security measures to ensure the availability, privacy, and confidentiality of all healthcare data that are electronically safeguarded, namely electronic PHI. Enforcement rules includes clauses regarding cooperation and inquiry, civil penalties for breaches of HIPAA, administrative simplification laws, and hearing procedures. And after approval of HIPAA in 1996, it was not successfully implemented till 2003. So HIPAA was extensively developed after adoption of High-Tech Health Information and Technology for Economic Clinical Health Act in 2009. And omnibus rule incorporating many aspects of the High-Tech Act passed as a component of the American Recovery and Investment Act of 2009, improving protection of privacy and health safety, and provided under the Health Insurance Portability and Transparency Act of 1996. And there are several exceptions to where the HIPAA privacy rule does not apply. For example, patient approval, it's corresponds in written form, and for therapy, for monetary settlements, and instances where general medical interventions and operations and registration of substance abuse problems from the legitimate abuse programs, and written psychological therapy notes during a cataclysmic event in nature, public health problems and interventions, reporting of child abuse or neglect, and anything ordered by the court of the United States. And there are patients' rights. HIPAA ensures that each and every healthcare seeker has the right to privacy, right to confidentiality of utilization of one's healthcare records, the right to accessing and modification of health records on request and for other reasons than processing and invoicing, the right to grant relevant authorization to utilize the medical records. The patients are also entitled to remove their names from their hospital databases and accounting lists as well. And all the patients are, entitled to for a notice of privacy practice. That's like a sort of a document which includes how their data, what data is collected, how they are going to be used, that sort of information data. So, and limitation of HIPAA includes like instead of types of data, HIPAA protection extends only to covered entities, leaving some of the confidential data at risk. For example, internet shopping, social media posts, and even automated transference of wearable device data to the internet. All of this information obtained and circulated online will ultimately enable more reliable health-related forecasts than that of a health record of an individual per se. And when we talk about general data protection regulation, it was that was mainly introduced in 2018, and it was adopted by European Union to cohere data protection laws across the European Union, and also to improve standards of protection in respect to relevant persons. And the broad multinational reach, it has about 99 articles and 173 recitals. So it's a very extensive, it's a principle, it's like a practice guideline, you can call it anything. And when you take the material scope, it has several definitions, like profit processing. It's defined as every action or collection of actions that is conducted with private information, set of private information, irrespective of its whether it is automatic or not. Personal data, they have defined as recorded information, signals, indications digitally. Anonymization is defined as the step towards creating personal information with the effect that the data is not linked to a person. Pseudo-anonymization is a popular tool for preventing identification of a person via data. Pseudo-anonymization means handling of personal data so that it can avoid the attribution of personal information to a particular data subject without the utilization of additional details. And we should think about to whom it can be applied. This is one of the important points. A controller shall be a natural or lawful individual, civil authority, agency, or other entity which is responsible by the means of processing of personal information alone, jointly with others. The processor in parallel to the controller is thus literally mean the natural, lawful individual, public authority, organization, or another entity which on place of the controller processing private information. When it comes to the territorial scope, this regulation shall apply in relation to the processing of personal information in the event of an operation of a controller or processor association, irrespective of whether or not the processor occurs in the union. That means, if the person, irrespective of the jurisdiction, if any countries, processing a citizen of data of a citizen of a European Union, it should be adhered to the GDPR compliant protocols. So, and while the GDPR is European legislation, its territorial scope expands beyond Europe, with the World Economic, with multinational organizations and cross-border data transmission. Global consideration were taken into account when the GDPR was created. Transnational implementation shall ensure the complete privacy and reasonable market competition of individuals on the internet market. The GDPR mainly applies, which includes personal information take place within the scope of operation of the controller. And there are several guiding principles. They include lawfulness, purpose limitation, data minimization, accuracy, storage limitation, integrity and confidentiality, and accountability. Personal data is processed legally, reasonably, and impartially with the respect of data subject is known as the lawful. And the process may also only be carried out if it is the subject to legal authorization or the consent of the data owner. And when it comes to purpose limitation, personal information shall be captured solely for defined, clear, and lawful intention and not utilized further in ways inconsistent with predefined purposes. And when it comes to data minimization, it says the GDPR says personal data shall be sufficient, appropriate, and restrained to what is required for the application. When it comes to accuracy, under the Article 5, Section 1, GDPR data shall be correct and revised whenever appropriate. When it comes to storage limitation, personal information shall be retained in a way that ensures recognition of individuals for analytical purposes for no more than required. And when it comes to integrity and confidentiality, confidential information should be handled in a way that guarantees proper security of data, including protection from improper or illegal treatment and from unintentional loss, destruction, or damage, particularly with the use of the required technological and administrative steps. Also, finally, the GDPR adopted general principle of accountability that enforces accountability for the adherence of processing with the GDPR and the weight of evidence for adhered compliance to the controller. And prior to actual standardization requirement, HIPAA framework, there are like several data formats HIPAA transaction has been done. Most of the health insurance systems and hospital information systems exchange health insurance data via these secure formats, such as formats such as X12, XML, as well as there are a range of network topologies such as LU6, FTP, TCP/IP, HDSP, and X25. And they are being used to connect the payers, clearinghouses, and healthcare providers. And HIPAA seeks to replace proprietary system with X12 formats and to improve the quality and efficiency of the data communication across payers and providers. These reforms were eventually intended to lower the transaction costs in the healthcare supply chain. The rules specifying the transaction format to complete transactions and code sets were released in finally 2000. Approximately after 2 years were given as the deadline for health insurance organization for draft compliance extension plan. The final rule developed national electronic standards for claims details, referrals, claim status, entitlements, enrollments, disbursement, benefits, alignments, and premium payments. In HIPAA, the congressional requirements for healthcare insurers, medical clearinghouses, and healthcare professionals that undertake such electronic financial managerial transactions to abide with the final standard set. HIPAA comprises of 3 key elements, which includes transactional codes, security protocols, and privacy rules. And this is like the lower figure shows an example of a HIPAA transaction illustrated. And these are some of the popular software platforms which are compliant with this HIPAA transaction, such as IBM WebSphere. iWay is a business analytical platform, and WaveTech. They are very popular. They are very well known for compliance with the HIPAA. And also, when it comes to another technological implication, is you can use the blockchain technology, and mostly it has been proposed that a health insurance claiming system using similar blockchain technology with the use of ledger, a distributed shared database that store linked sequence chunks, each having protected timestamp and transaction record, and smart contracts, a script that is executed automatically, enabling process logics based on legislative contracts evoked on the ledger in a secure manner. And this has enabled to automate HIPAA-compliant health insurance claiming processes with incorporating insurance policies and access control. And one of the popular EHR solution is MedRec, with blockchain technology for electronic medical record systems, and it very famous for verification, privacy, consistency, and information exchange in handled with such system. So I think openIMIS, I think when we develop that, I think big country-specific adaptation and customization, we could look into these kind of technologies. And also HIPAA compliant web service architecture. With the growth of digitizing health information, it could be generally anticipated that the need for privacy augmenting solution, particularly provided by the web services, is ever growing. And it has been presented a vocabulary-based conceptual architecture for designing and development of HIPAA-compliant web services and applications to enable integrated, collaborate, protected health information. In this proposed model, Hippocratic data layer refers to the topmost for viewing PHI in HL7 standardized XML formats. HIPAA privacy layer is used for privacy protocol enforcement. And there are other common methods such as physical safeguards, technical safeguards, administrative safeguards, which are very much important, which I'm going to describe in detail. So physical security means access to PHI physically. It involves physical accessibility to a specific place or physical item, such as building, facilities, protected areas, hardware devices, documents, etc. And accessibility to facilities for persons who are no longer under the employment by the company must be terminated, while approval, establishment, monitoring of the such access to current employees, and equipment including photocopy machines to even ECG machines must be tested and cataloged before physically moving them in and out of the facilities. Access tokens such as passcodes must not be exchanged or left or unattended. And the regulating and monitoring of individuals accessing protected zones essential, and security precautions should be implemented. When it comes to technical safeguards means the power over accessing computer systems and safety of a PHI transferred electronically. Technical safeguards discuss such as whom and how an individual is being able to access, read, write electronic medical records, and PHI must be protected by transmitting to other places, and data must always be impossible to be read by encryption before the encryption code is applied. Many facilities use a third-party application to encrypt email content. This security goes beyond access control where passcodes or passwords can do alone. And free and open web-based email systems such as Outlook, Gmail, Yahoo are usually not safe for protected health information transfer. Even cloud-based email system hosting HIPAA confronting servers such as MS Office 365 do not monitor the email transfer from the cloud server to the email destination. Because, and it's important to understand, even it accepts from the protected health information transfer rules. If you send an email of patient data, it's not considered as a PHI transaction even. The safest solution is to stop sending emails with PHI altogether. Utilize patient information portal instead of communication page, instead to communicate PHI data. This service is provided by plenty of electronic health record solutions. Technological protection advocate for application of protected PHI security protocols, application hardware in the backing and restoring and transmission of electronic patient records. Systems should include encryption, decryption methods. And also, it's important to understand that standard operating procedure SOPs plays a vital role. It must be developed to discard the PHI whenever the task or feature is no longer needed, and dumping of PHI records should be processed in correct and standardized manner. And it's equally important about is the administrative safeguards. These safeguards enable healthcare institutions to develop and amend policies and procedures timely to ensure the protection of PHI by means of which employees can learn and comply. It's important to discuss them with examples such as acceptable usage policies designed to train staff about their rights and obligations of managing PHI. Penalty policies is mandatory for disciplining workers who breached the main policies. Accessible information policies granting sufficient access to relevant workstations, machines, or hardware, medical records and transactions, and other services mechanism. Capacity building and on information and cybersecurity to advise and reiterate support and maintenance protocols. Device logout audit logs, user credential changes, and other visual security checks. Those are all included in the administrative safeguards as well. Contingency planning in order is important in that because it's to ensure proper planning. Policies, protocols are all in effect for the effective prevention and response, such as cybersecurity threats, property destruction, theft, or environmental catastrophes. Contingency planning related essential tasks must be included, identified managers so that each staff member is aware of what to anticipate in a crisis or an incident. So when it comes to data protection laws in Sri Lanka, there are various acts and piece of legislation. The thing is, in the constitution itself, the personal data protection is not addressed. It's just mentioned in the constitution of Sri Lanka, but it's not thoroughly addressed. But those are invariably somehow addressed in these are following acts and policies, such as Universal Declaration of Human Rights, Medical Ordinance Act, and Health Services Act of 1952, Health Master Plan 2016 to 2025, National Health Policy of 2016 to 2025, A&E Care Policy of 2016, National Health Information Policy, and Policy and Procedure for ICT Usage in Government, which is commonly known as e-government policies, Lanka Interoperability Framework, and Sri Lanka Government Information Classification Framework, Information Communication Technology Act of 2003 and amendments, and Electronic Transaction Act, Computer Crime Act, Intellectual Property Act, Right to Information Act, National Medicines Regulatory Act, National Archives Act, Telecommunication Act. So all these legislations are somehow in one fine corner, it addresses the importance of personal data protection, but none of them has it has never come together. Also, it's important to understand in Sri Lankan government there we have a process of information classification within the Sri Lankan government, and it's within that classification model. We have classification such as public data, limited sharing, confidential, secret data, and DLM, there is disseminated limiting markers, which is known as DLMs. They can be sensitive legal, sensitive private, sensitive, and sensitive government, and a lot of caveats as well. So these practices are there, but the thing is enforcement and its implications are not very much followed up. And when it comes to healthcare, even Ministry of Health has issued guidelines, such as for guidelines for information security guideline for healthcare institution. And also we have national e-health guidelines and standards. Now the version 2 has been released as well. These guidelines addresses a variety of data protection mechanisms and laws which have been invariably involved around the digital health ecosystem of Sri Lanka. And finally, I would like to point out the Data Protection Act of 2022, which has been released very recently, like 19th of March 2022. This is one of the out of all the pieces of legislation, this is one of the key legislation which has come up recently. But the thing is, this has been primarily aligned with the adopted from the GDPR. So it has the same principles. So when we go through it in detail, there are 10 parts and 6 schedules. Part 1, it refers to processing of personal data, right of the data subject, and controllers and processors, and use of personal data to disseminate solicited messages, and data protection authority. And part 6 refers to Director General and the staff of the authority. Part 7 refers to penalties. Part 8, fund of the authority. Part 9, miscellaneous, and part 10 is interpretation. And one of the key important part is for theoretical point of view are the schedules. Schedule 1 describes the conditions for lawful processing. Schedule 2, conditions for processing of special categories of personal data. And Schedule 3 refers to conditions for consent of the data subject. Schedule 4 refers to processing data relating to criminal investigation. Schedule 5, collection of personal data. And Schedule 6, members of the board. So it's important to understand this is not only the healthcare or health insurance data. This is mainly personal data in any domain. So when it comes to health insurance information management context, one of the key part is the part 2, right of the data subject, which includes right of it's very coherent with the GDPR, such as it has like similar clauses such as right to access the paid personal data, right to with that means every patient has a right to if he right to their access to their own personal health records, and right to withdrawal of consent, and the right to object to processing, and patient has a right to rectification or completion, right to erasure, grant or refusal of rectification, completion, erasure, or refrain from further processing, and related to automated individual decision making, right of appeal of data subjects to the authority, and the process of determination of such appeals. That means any citizen as concerned when it comes to the healthcare data, they have the full authority and full control, and they have the right to request for any utilization or any execution of their own data. So these are some of the challenges which can be identified in the health insurance information management, where as data protection laws are concerned. Although there's a breach, I mean there are thousands of rules, but it won't do any good if there's no proper enforcement mechanism. That's what's happening in Sri Lanka. And there are, when it comes to the Personal Data Protection Act, there are no clear definitions with regard to healthcare data, because if you further if you can download this act from the below link. And but the thing is, if you look at closely, most of the healthcare data is never defined anywhere properly, and certain clauses related to healthcare data disclosures are mischaracterized. For example, in one of the schedules, it has um, certain clauses which allows the disclosure of personal health data in terms of communicable disease outbreak. So the main argument is it only communicable diseases, or maybe and also there are certain other mischaracterization of words used, such as occupational health, that sort of thing. And also, it's important to understand there's a lack of awareness of data protection laws by the health insurance stakeholders. I mean, most of the, in my previous research on health insurance information management in the private health insurance industry, one of the key finding was with the high high court conference, is most of the health insurance agents or employees, and or even the high level administrators, they know there's something called Data Protection Act, or it's coming. I mean, there's the data protection bill coming up, but nobody has read it, because maybe they have thought probably the enforcement is not very strengthened. So that's that sort of thing. And also the public, there's a lack of public awareness and culture of data protection laws and its implication. If you take even the citizens, most of them, they don't care what when it comes to the concerns of healthcare data. They don't worry about what are the data they are being given. They'll be leaking, or they'll be providing, what sort of implication it would happen. They just if they ask for any personal health data, they would just easily given up. And also there's one of the major problem is there's no linkage between the health insurance and the healthcare domain in Sri Lanka, because health insurance primarily it's a private, predominantly it's a private health insurance companies. It's a composition of they govern the most of the health insurance setting, and the healthcare and the Ministry of Health and the Ministry of all the private health insurance industry entities are not very well connected. And there's also always a problem where data protection authority or data ownership regard to health insurance data were undefined. And also health information software vendors are not aware of data protection principles most. And also, I mean, it's very important to understand most of these problems are even aggravated because we don't have a unified system that process health insurance data. So, I mean, this is where even the openIMIS comes to the picture role in Sri Lanka, because probably our long-term plan would be to get even all the private health insurance companies, they can have their own systems, but when it says national level, they can be modified or customized to using APIs and APIs to push the data into a one particular national system. And also, and one of the aggravating factor is poor detection of privacy breach by health insurance companies as well. So, if you take daily basis routinely, always there's a privacy breach, but sometimes even the company doesn't realize it, even the user, nobody realize it. For example, would be sometimes it's a common scenario in Sri Lanka where sometimes all the health insurance companies they collect the patient investigation reports from the designated popular laboratories. So if somebody go and do a lipid profile, and if it gets high or something like that, and whenever they go to obtain an insurance policy, and their laboratory test is already with the health insurance company, whether they know it or not. So that sort of dilemmas still exist in Sri Lanka. So I'll be closing this session with a grand question. I think that's what our community is all about. So these lessons, our discussion can be beneficial for all the other countries as well. How can we overcome these challenges as a community of practice? So I would like to open this forum for any discussions and suggestions and on this regard.
Thank you, Dr. Chamika. So, for anyone who would like to speak or share their thoughts, the chat box and your microphones are open. Maybe while waiting, Dr. Chamika, we can answer some questions from Dr. Agarwal. Dr. Agarwal is asking, has data protection laws of Sri Lanka given absolute control in the hands of the data generator?
Currently, because at the moment, practically it has not, but according to the Data Protection Act, they should be. Because so the thing is, currently we are still in the phase of getting all the health hospital implementing EHRs, EMRs in the country. So I think about already we have covered about 60% of the hospitals, but so far, there were no requests or or anything like that to change their personal data records. Maybe that's why I think the lack of public awareness of the right of the data subject is very apparent. So I think if they know about it, I think probably they would access it. They would go for it. I hope that answers your question, Dr. Roa.
We have another question from Dr. Kevin.
Yeah.
How to verify the compliance of digital health systems to this policy framework?
I think it's a very complicated. I think it must be a multifactorial. When it comes to, if you take from the technological perspective, I think the systems should be designed and developed to one thing, to flag any privacy breaches, and always secure. All the secure policies, and it should be always backed up by the legislative framework. But the thing is, if you take the health insurance companies, if you take private health insurance companies, I think it can start with according to my purview, I think it can start from very grassroots level. I think from if your institution, you can have your own non-disclosure policies and HIPAA or GDPR or any hybrid version, that sort of data protection laws, that's law-based policy framework. And then strictly, it should be properly communicated to the system developers, administrators, architects to incorporate that sort of digital health systems which compliant with, because as I can understand, most of the health information systems are not face it, when it comes to the our non-developed countries, it's not very much addressed in the from the systems per se. But I think that's something which these data protection laws are a big eye opener for all of us for prospective future digital health system design. So the systems can be designed to verify the compliance of these policies, and always these policies should be backed up by legislation. So you can do a lot of legal reviews, and probably even if necessary, legal reforming can be done as well. I hope that answers your question, Kevin.
It seems there are no more questions from our participants. I think we can wrap up the session here, Dr. Chamika. Once again, thank you for sharing your work with the AHIN community and the openIMIS community. To everyone in the call, we would like to invite you as well to take the e-learning course of the openIMIS initiative. It's available in the socialprotection.org. The course is titled Introduction to openIMIS. And once again, we would like to thank our participants for making the time to join our session for tonight. Thank you, everyone.
Thank you, Christine. Thank you, Chuck. Please give my regards to Dr. Alvin as well.
Thank you, Dr. Chamika. Keep safe.
You too. All take care.